these sort of discussions for me are really important, because this is how we evolve.
So my name is Naomi Oyoe Ohene Oti, and I'm an oncology nurse specialist, also a public health practitioner, and the head of nursing at the National Radiotherapy Oncology and Nuclear Medicine Center, Korle Teaching Hospital, Ghana.
So my name is, as you said, is Anthony. Please feel free to call me Anthony. No need to have any formality here today. I'm an MD, medical doctor by training. I practiced clinical medicine for about 13 or 14 years prior to entering industry. I also served as chief medical officer of a hospital system. The last 10 years or so, I've been really focusing in on how to integrate the patient into the drug development process. And I think we're going to talk a little bit about that today. And I very much look forward to our conversation.
I think your title, being the head of patient centricity, it's quite interesting to know how you define patient-centric care, and how does this relate to your current role as Astellas?
Yeah, so thanks for that question. I think I'll start with the idea of what is patient centricity. And for me, there's a couple of different definitions. First, it's a conscious awareness of the patient and all that we do inside of Astellas, so that as we come to work every day, we have a clear focus on what it is we're doing and why we're doing it. Patient centricity also requires process changes and infrastructure changes, so that as we gather patient information, we're able to utilize it. And that is really the focus of what I'm doing at Astellas and what we're building at Astellas. It's the ability to systematically obtain and partner with patients, so we understand their perspective of their disease, the practitioner's perspective, the caregiver's perspective, but then create processes internally so that we can utilize that information in the next generation of drug development. So all of my focus at Astellas has been to bring the patient's perspective into the traditional process so that we can better utilize it to develop the next generation of medicines that will have more direct, clinically meaningful benefit for our patients. And I know that's something that's not very foreign to you, because I looked through your history, and it's pretty extensive with clinical practice in nursing, and also building capabilities at your hospital. And I thought it was pretty fascinating. And I'm interested in understanding what drove you to nursing, but more specifically to oncology, and then the work you're doing inside of the Center of Excellence.
All right, thank you. What drove me to, I think during my, for nursing, would say, most children will see someone and become like a mentor. So mine was this, and there was this nurse who was master of everything. And anytime everyone is sick, whether especially during the midnight or the night when we don't have the full clinic running, you usually will go to her, she will solve issues. If it's beyond her, she will refer. So seeing her with her uniform every morning working, and even maybe at night, was being the champion of health, delivering healthcare, I thought twice that I really wanted to be like her. And I think that was one of the main things in entering nursing, to be able to render care to people. And for oncology, I remember almost my final year in nursing, we went to, that was a surgical ward, and there was this patient with CA breast. I just asked the surgeon in charge, so what is happening? But she was mourning, she's in pain, lymphedema, but she was a strong, ECOG was like one very strong woman. Asking, so what is happening? Said, okay, we are at the end of the crossroad. We don't know what she's had surgery. There was recurrence. She's had chemo, and now there's nothing to add on. At that time, they've not established the radiotherapy center in Ghana. So I was a bit curious to find out how, in terms of caring for such patients. So, I got the chance, I applied. Doing after school, I applied and got to work in the National Center. That's a premier will I say, the premier cancer center in Ghana. And I think I found some mentors on the way who helped me to stay put.
That's really interesting. And I see that mentorship is so important, right? Especially when you have areas that are very specialized, very critical, and often very stressful. I'm sure you also have programs currently to try to mentor other younger people into this space. Is that part of what you're building in your hospital?
Yes, we currently have something. We help to Ghana, since that in 2015 we're able to help help a curriculum. Initially we were doing an in-house training to be able to support to build capacity to be able to deliver the care, but we saw there's the need for formalized training to rather empower more nurses, in a higher capacity to be able to deliver cancer care to our patients, because now our patient needs are becoming complex. So in 2015, myself and a few nurses came together with the help of Ghana College. They started this a postgraduate program, it's a postgraduate oncology nursing program. We still have few oncologists. Looking at our population, over 30 million, currently have about 12 oncologists in the whole of Ghana, only spread into the two major facilities. So the thought was to prep up nurses at the postgraduate level to be able to fill in that gap, especially if they are in the districts, because we saw that people were reporting late, and if we, in terms of if the knowledge base is quite strong, there will be early diagnosis. People may be able to come to the needed facilities early, so that there will be early interventions. We also saw that there was lack of information was making the patient more, anxious in terms of adherence to treatment, because people fall out. The information that we're given, sometimes they don't understand. So we try to create, as part of their processes, we created a desk where when they come in, especially their first time, we try to go through the treatment process. We're also looking at establishing, I think, a cancer survivorship plan. We know there's follow-up, a normal follow-up where patients usually come for their follow-up that need to be looked at, and having a designated clinic for them, a survivorship clinic, even led by nurses.
That's great. It's very impressive.
I just want to know, with all that, we know that it's not patient-centric, it's not something not new, it's not new, but how, what made you interested in this area, and how have you seen the patient-centered care evolve in the past decades?
Yeah, so again, I've been fortunate in being having a career that's been patient-facing, throughout all of my experiences, and it's very rare to have that opportunity, from medical school right to clinical practice, to seeing healthcare being delivered from an administrative side as a chief medical officer, and then entering industry and having the ability to really focus in on the patient is such a privilege. And I think that's really what drove me to thinking more about the patient, the end user of what we're developing. 10 years ago, when I started this work, it was sort of, even though in the development process, from discovery all the way through the launch of a new medicine, the patient was being thought of, there was very little interaction 10 years ago. Patient centricity wasn't even a term 10 years ago. It was sort of assumed that we understood standard of care and we knew what the patient expected. And in reality, we really didn't. We really didn't have a very clear idea of what the gaps were in care from the patient's perspective. It's so important to understand that. Understanding that exam room interaction with the patient and the physician, understanding the caregiver's perspective, and then taking that information and bringing it into the drug development process from the very earliest stages, from when a scientist has an idea all the way through life cycle strategy. is critical. And from my experience in practicing medicine and seeing healthcare from the different perspectives, to me, it just made sense. And over the last 10 years, there's been a lot of progress for sure in understanding the importance of the patient perspective, understanding the differences that we need to be clear about when it comes to new medicines entering the marketplace. Understanding the clinically meaningful benefit is critical. Understanding the patient, the physician, the caregiver, that interaction is really important. Understanding behaviors that interfere with care and behaviors that promote good care. All of those things are critically important and are now being becoming very important ingredients into new drug developments. And I'm so happy that industry and along with our patient partners are moving in that direction, because I am very optimistic that the future of drug development and the integration of the patient is just beginning. And the patients in the community are going to become our closest partners.
Right.
Yeah.
So it's quite fascinating, because now clinical trials are now moving to patient engagement, so that they'll be able to focus most of their research in that area, which will benefit patients as well. So it's quite fascinating to see pharma also going into that area. So at the end of the day, we all seeing that it's a patient outcome, isn't it? Because you want the outcome to tell people that this drug will be working, and putting patient first, that's a very good thing. I want to know, has there been any challenges moving even further towards this holistic patient-centric care?
Yeah, I think there's definitely challenges. Some we've overcome, some we're still facing. Whenever in any industry you integrate a new process into a traditional process, you know that better than anyone with what you've just described. It's very difficult to gather acceptance, even if logically it makes sense. So one of the natural barriers to this in most instances is just the traditional approach and how you can effectively and impactfully integrate these new approaches without creating a feeling within the drug development process that you're creating obstacles or barriers. So I think integrating in a way that makes sense, integrating with your internal partners, not forcing it, but showing the value to this information is going to be key moving forward. And again, also partnering with our patient advocacy groups and our patient partners. All of it makes sense. We have to expect that it's going to be a process inside of companies to change the infrastructure that's necessary, but it's very doable. And I think the value that is clearly seen when these processes start to take hold is the motivation for it to continue. And I think the clinical trial piece is very important. And I know that you were involved in not only clinical trials, but interestingly, the registry piece. I thought that was pretty interesting when I read, you have a very impressive background, and I read some of what you published, and you were talking about the importance of not only being part of clinical trials, but creating registries that are more usable and creating the opportunities for this information to be more widely available to make decisions. Tell me a little bit about that. I'd love to hear your thinking.
I think, it's been quite difficult. As we all know, registries are very important for decision making, and in terms of whether we are making progress in our treatment or not. And especially those of us from the low middle income countries do not have quality data. So there has been struggling back and forth, but we're trying to do some. It's more of interest, but I think the government has come in, and we're hoping for a better interest in that setting. And for clinical trials, I think there's been a lot of trials going on now, but we hope to have more well-established cancer clinical trials to be able to help our patients. And with a paper on this, a series on clinical trials, and we talked about various regulatory bodies, as Ghana having a regulatory body and the various outlines for you to do clinical trials. And I think that is very encouraging for other low middle income countries, especially within Africa, because there's a need to also, if we say we are being patient centric, we also need to protect the patients. And having those regulatory bodies become a yardstick, if we adhere to all that they are saying, we'll be able to protect our patient at the same time, have a better outcome. We need this registry to be able to do clinical trials, to be able to come out with new drugs that will help our patient. And you know, that is not really ongoing in Africa. So having a good established registry, I think will go a long way to improve our clinical trials.
I think that's fascinating. And the other thing I wanted to touch on, I thought it was pretty interesting, is your psychology background. Part of what we're building inside of Astellas is a behavioral science consortium, and a specialization to understand behaviors, because behaviors are a big part of the success or failure of treatment, not just delivering the medicine, but a real world application. And behaviors can be quite important. And so it's interesting that you, with your psychology background, have you found that to be helpful? Have you found it to be something that has been impactful in your treatment of patients?
Yes, actually, we will say nursing go hand in hand, or clinical practice go hand in hand with psychology. The way people behave is very important to know how people behave, and it will help you to strategize in terms of delivering of your care, and also in terms of it also helps you to know how people are feeling. I mean, the interventions that you're giving out, the outcome. We have different, you should know that there are different groups of people. People assimilate information differently. So having a psychology as a background has really helped a lot.
That's interesting. Yeah, I agree. I think psychology and understanding the patient in almost every setting is really critical.
Right. So I think we all know about this menace that is coming up. It's COVID-19, which is now a global thing, because almost, I don't know which continent has not been hit with this thing. This has thrown more light on the critical role nurses play in the frontline care, and we still have seen this lack of nursing staff, which has been existing. We know it is an existing challenge, and even before the pandemic. How can we value the profession more and entice young men and women into nursing? Because it takes a lot to do nursing, but some people feel that people don't have value for money. What you put in, you don't get. So you could have a lot of young people not taking up.
Yeah, I know that you published an article on COVID-19 as well in low and middle income countries, which is great. And we've done some studies through our behavioral science consortium to look at COVID-19's impact on cancer patients in a couple of different regions in the world. And the thing that interested me the most, I think, we're all hopeful and optimistic that COVID will end at some point, hopefully very soon. In the next few months, we'll start to turn the corner, hopefully. And perhaps the pandemic will be behind us. But the thing that interested me in our study of it is what impacts to patients that we saw exaggerated by the pandemic, but existed prior to and will exist after the pandemic. So there are certain things: access, travel to offices, ability to utilize technology for visits when you can't get to an appointment, whether it be because you don't have the financial resources, you don't have the health ability to get to the appointment. How do we look at the things that were exaggerated but will persist, and how do we then adjust our approaches so that we can better serve patients? So that's the areas that I think for me are going to be most impactful post-pandemic if we're going to learn our lessons as an industry from the pandemic. To your point about how do we get the next generation of young people to want to join this very, very important industry of delivering care. My view is that I think the pandemic will see a larger number of people interested in going into the medical field, nursing and healthcare in general, physicians, medical schools. And I believe that because I think as awful as this experience was, and it has much of a sacrifice these heroes have made to deliver care in these very trying times, I think it also motivates people who truly have the heart to make a difference. And I think when they see what impact individuals have had on the lives of patients, on the lives of their families, on society in general, I'm optimistic that we're going to see more and more people over the coming years interested in entering into healthcare delivery. And I think a lot of it's going to be motivated by people like you who are working every day, who are publishing articles about it, and are mentoring younger people as an example. Examples are for me, they're the clearest driver for the future in every way. They can be negative and they can be positive. And I think your example in your hospital and hopefully what we're doing inside pharma are the positive examples for young people to want to follow in those footsteps. I mean, what's your view of it?
I agree with you on that. And but COVID has made us project nursing and even those in the medical field because of their contribution to healthcare. Because if you do not have this workforce, it would have been really tragic because they have been on the front line. And I'm using this medium to encourage more younger men and women to join the noble profession, all the medical professions, to be able to do their best for humanity. But this year is quite appropriate because I know people are falling down the line, they have sacrificed big time, and we need to celebrate them. And I agree with you on that. COVID has also brought light into the medical profession.
I think in the end, at the end of the day, we're all truly in this together, whether it be developing medicines, delivering care, whether you're in a lab creating new molecules, whether you're in an ICU delivering the medicine to the patient in need. This has to be a collaboration. It has to be all of us in this together. We need to have open communication. We need to learn from each other. We need to take the best of everyone in order to change the way we do business, whether it be developing the medicine, delivering the medicine, caring for patients in their homes or in the hospital. To evolve in a better way, it's going to take all of us.